that we have patients who have lung cancer screening as a method to detect early lung cancers, how do we decide when they've had a positive scan, what do we do now? Well, really, when patients have a CAT scan of their chest for lung cancer screening, there's really two types of abnormalities that we can see. One type of abnormality will show us that there's a problem in their lungs, that there's a lung mass, something there that doesn't belong. But in addition, they can also have other abnormalities not related to their lungs. For instance, they can have calcifications of their coronary arteries that are more than we would expect that might suggest that they have coronary artery disease. Or they can have an aneurysm of their aorta, which might warrant further investigation. And so what I'd like to do is talk about these two things. The major thing we really want to talk about, though, is when they have an abnormal mass or an abnormal shadow or something shows up on their CAT scan to suggest lung cancer. What is the next step? Well, usually the next step, first of all, is to discuss this with your family doctor about what exactly are your risks and how far do we need to go. In most patients, if they've met the requirements for being at high risk for lung cancer and they have a new nodule on their lung that hasn't been known before, obviously the concern is this is a cancer? The first test that we would probably get is what's called a PET scan. And what it is it's a special scan where you're injected with a special medicine that's taken up preferentially by cancer cells. And if on the PET scan, the nodule that you have lights up with this medicine, it makes it very suspicious that this new mass that's found is perhaps a cancer and very concerning. Further evaluations can also include a bronchoscopy with an attempt to biopsy it. Sometimes patients can be biopsied by other techniques as well. And we actually have several forms of bronchoscopic techniques using ultrasound or using special GPS mechanisms that we use, which are new techniques in bronchoscopy that are relatively non-invasive to help try to determine exactly what that mass is. In addition, we want to look at other things that we'll see as well on the PET scan, like lymph nodes, whether or not they're spread anywhere else in your body. If there are concerns that the mass you have is a cancer, that's something then you'll need to be seen by either a pulmonologist or a thoracic surgeon to further discuss the evaluation and what treatment options then are available. If the mass is found to be a cancer ultimately, you'll also need to be seen by an oncologist to discuss other treatment options. Now, if the mass is found, if in addition to the mass you're found to have something else like coronary artery disease or an aneurysm, these results can be communicated to your family doctor and a referral to the appropriate physicians could be made very simply.